You have been wanting a video on the shingles vaccine, so here it is. Hi, I'm Dr. Brittany Todd. I am a pharmacist. Let's talk about shingles and the vaccine effectiveness and safety. First off, 1 in 3 Americans will develop shingles in their lifetime. Most of the time it's a one and done and it doesn't recur, though it can. That's 1 million cases of shingles per year. The main issue with shingles is something called post-herpetic neuralgia, which just means that where the rash was, it causes a chronic pain. About 15% of people will get post-herpetic neuralgia. The highest risk populations are over 60 years old and immunocompromised, but it only leads to about 100 deaths per year. Since the 1980s, the incidence of herpes zoster has increased by 3-fold. What's interesting is in 1995, that's when the varicella chickenpox vaccine came out. And since then, we have seen a huge rise in the incidence of herpes zoster. There's currently only one vaccine for herpes right now. It is called Shingles. It is an inactivated vaccine, meaning it does not have live herpes zoster. The reason for that is the live attenuated vaccine, Zostavax, was pulled from the market in 2020. They found an increased incidence of post-herpetic neuralgia, stroke, transverse myelitis, blindness, and death. So now we just have Shingles. Shingles is about 90% effective for about 7 to 10 years, which means after 10 years, the vaccine wears off. It's given in 2 doses, 2 to 6 months apart. Usually we give it to people over the age of 50, though if you're immunocompromised, we can give it if you are 18 and over. There is a component within this vaccine called the QS21, which is a plant product that activates the immune response to the inactivated herpes zoster virus. But it is associated with what we call grade 3 side effects, meaning not only do you just get a fever, pain, redness, muscle aches, joint aches, it's grade 3, meaning they are pretty severe side effects. After this vaccine hit the market, Guillain-Barré syndrome raised its ugly head again. There are 6 extra cases of Guillain-Barré syndrome with Shingles per 1 million doses. And those are seen within 42 days of giving the vaccine. Since the approval of this vaccine, there have been over 65,000 reports of side effects in VAERS. However, most of those, about 97%, are just for mild injection site reactions. Now, one of the arguments people say against VAERS is it is a passive reporting system and anyone can report. But interestingly, over 76% of reports in VAERS were reported by the manufacturer or a healthcare provider. There have been 8 deaths confirmed by autopsy from the shingles vaccine. So the big takeaway, it's about 90% effective, but the immunity wanes after about 7 to 10 years, and there are some serious adverse events that come along with this medication.